Hi, my name is Dr. Kristen Fox. I'm one of the veterinarians here and also one of the practice owners here at DePora Veterinary Hospital. I am here today to chat about cat dermatology and cat skin issues. So hopefully can just get some more information out there and hopefully answer some questions. So if you notice any type of a tumor growth lump on a cat, I'm always a little bit concerned. When I was in vet school, I vividly remember the oncologist telling us any type of a skin lesion on a cat that is a growth should be checked out. Dogs typically get tons of different benign and non-worrisome things, but generally anything on a cat needs to be evaluated further. And a lot of times, if it's something, even by how it's looking, we might even just be going right to a surgical removal and recommendation. Skin lumps on cats are really, really rare, so when we do see it, it is something that puts a little bit more of a red flag for me that we need to be a little bit more aggressive just to make sure that this is going to check out okay. So if you're noticing your cat is itching or scratching excessively, or another way that a lot of cats do show when they're itchy is over grooming or licking, the most common cause is still probably allergies. We're actually going to be doing a separate allergy video just focused on that because it's a little bit more involved topic. But if the allergies aren't one of the big things, the other thing that we see a lot in cats is we do see it manifest as more of a behavioral issue. So a lot of cats will overgroom and be itchy and showing those same symptoms because of a stress response. The third thing, which we always talk a little bit about, is a flea issue. So some type of a parasite, what we call an ectoparasite on the skin. So fleas, other type of fungal things like ringworm can also cause that. You can actually even see what's specific in cats called the flea allergy dermatitis. Flea allergy dermatitis is actually where even just one flea bite will trigger an allergic response to that flea, and these cats are really, really, really itchy. Typically with flea allergy dermatitis, the distribution on their body is typically their back half, and so you'll notice they just keep licking and bothering their back end, and sometimes you'll actually see a distinguished hair change in their coat, even on their what we call the back half of their body. So just another thing that can potentially cause that. Obviously, the treatments would change pretty significantly if you're treating a flea issue versus treating more of an underlying allergy. So most of the time, feline dermatitis is going to be diagnosed by just a really good physical exam by your veterinarian. What we're looking at is we're looking at the hair coat on the area of the skin itself. Is it red? Is it irritated? Is it oozy? Is it dry and flaky? So that's kind of what we're looking at. And what the underlying cause that would cause those changes to the skin typically will present differently in how it looks. So a really, really good exam is where you definitely want to start. Depending on what the veterinarian finds, we might talk about ringworm cultures, we might talk about skin cultures, we might talk about skin scrapings or skin cytologies. So there's kind of a further testing that might be involved, but that first step is just a really good physical exam. So we do see a lot of issues with fleas and ticks. Really, especially cats, I worry about fleas, especially those cats that are going inside and outside. And not as much even the cats that are just going out in your yard, or I have a lot of clients who maybe have a nice porch where their cat goes and sits, or sometimes there's these different tent type things that cats will go spend some time in the yard. So they're not out roaming the neighborhood, which is great, but there's still a concern for fleas and ticks as well. But that is an easy way that fleas can kind of get on your cat, and then they can bring them inside and expose your other animals as well. So the best way to protect them is if your cat is going to be outside at all, I would recommend them being on a good flea and tick preventative. My preference is Revolution. I like that it also protects them against, ear mites and heartworm disease and some of the other things that they can have exposure to while being outside. And it also does great for fleas and ticks. Obviously, there's other over-the-counter products as well. Frontline Plus is also a great option that offers good protection for fleas and ticks. It doesn't do some of those other things I mentioned, but if you're really just focused on fleas and ticks, Frontline Plus is also a great product. So if you notice a hot spot on your cat, and what we call a hot spot typically is what we call deep moist dermatitis, meaning it's not just a little bit irritated. These are typically more angry, they're really red, they're usually kind of oozy or crusty, and I would expect your cat to be pretty itchy with this, which usually is going to show up as them really wanting to lick and lick and lick this area. If you notice that, you definitely need to come in for a good exam. Most of those cats are going to need for sure an antibiotic and maybe additional medication based on how the wound itself looks, and then the conversation is what the underlying cause would be. So definitely want to recommend a good exam with your veterinarian to kind of get that further evaluated. Thanks for spending some time with me today talking about cat allergies. If you have questions or want to have your cat evaluated, please feel free to call and make an appointment. We do also offer online scheduling now, so if that's easier for you, we would love to see you and your sweet kitty. Thank you.